The daratumumab, carfilzomib, and dexamethasone being presented here at ASCO, I think the importance of this study is that we already know there's a lot of phase 3 publications recently in relapsed refractory myeloma showing that triplet drugs are better than doublet. But the problem with a lot of those regimens is they use len-dex as a backbone regimen. And with the increasing use of lenalidomide maintenance, many patients would be ineligible for those studies. So it's nice to have options for lenalidomide refractory patients. And here, this is from a phase 1 study called the 1001 study where daratumumab was added to many backbone regimens. And so first and foremost was safety. There were no new safety signals with the combination of dara and carfilzomib. Interestingly, the neutropenia rates were relatively low for relapsed refractory myeloma, only about 20%. And in terms of efficacy, we saw a response rate of 80% in the entire population. And in the 50 patients who were len refractory, there was really no difference. And impressively, the progression-free survival was 14 months. And to put that into context, other regimens with len refractory have had much more modest results. Admittedly, there's going to be differences in patient populations, but it can be as short as POM-DEX, 4 months, to other regimens showing about 8 to 9 months. So I think this 14-month signal is interesting and hopefully will be validated in the phase 3 study with carfilzomib dex plus minus dara. The other important development from this study is the ability to give daratumumab as a split dose, because one of the limitations of using daratumumab in the community setting is the long first infusion with a median of 7 hours. Here we showed that you can do split dosing of dara over 2 days, and the median infusion time was only approximately 4 hours. And interestingly, the infusion-related reactions were typical, about 40 to 50% in most studies in day 1, but on day 2 was only 3 to 4%. So I think it's an important option for patients and community doctors to be able to give daratumumab as a split dose.